Hello everyone, welcome to another video of this revision series. In this video, we will talk about cardiac cycle. Cardiac cycle is simply defined as the events occurring repeatedly or cyclically in heart that constitutes the cardiac cycle. And the duration of cardiac cycle can be measured the time duration by average heartbeat in that time. And usually we take heart rate in respect of minute, so 60 second by average heartbeat in that minute, and it is usually found as 0.8 second. So in this 0.8 second, the atrial events, that is atrial systole and atrial diastole, completes. Also the ventricular events like ventricular systole and ventricular diastole complete. And the duration of atrial systole is 0.1 second and the diastole is 0.7 second, while that of ventricular events, ventricular systole is 0.3 seconds, which again has three subphase like isovolumetric contraction, slow ejection and rapid ejection phase. And ventricular diastole, which constitutes 0.5 second, has again 5 subphase: protodiastole, isovolumetric relaxation, diastasis and second rapid filling phase. Now if we want to discuss all these events, especially the ventricular events, because atrial events are so simple and there is no such complications or no such important features, because mostly atrial events are passive in nature. Atrial systole causes blood entry from atrium to ventricle, and that is mostly due to gravitation. So we will mainly focus on the ventricular events, and here one important thing should be remembered, that is atrial systole coincides with the last phase of the ventricular diastole, that is second rapid filling phase of ventricular diastole. So in this graph we will discuss various points all together so that we can actually visualize the events one by one. In a red curve, in this curve I have detected the aortic pressure curve, and in the green curve the intraventricular pressure curve is depicted, and the orange curve here, it is the simple venous pressure curve. We should not much bother about this, and this is simply the ECG tracing according to the change of cardiac cycle. And here also this is the sound, various types of heart sounds. Normally S1 and S2 are present, and sometimes S3 and S4 are also audible, but in which point of cardiac cycle this can be auscultated, it is to be remembered. And this is the ventricular volume curve. This violet or purple color is the ventricular volume curve. So first, the aortic pressure curve, comparison between the aortic pressure curve and intraventricular pressure curve. Normally aortic pressure curve fluctuates in between 80 to 120 mm of Hg, and ventricular pressure curve also reaches 120, but its lower limit is much lower than the aortic pressure curve. And at the starting of ventricular systole, aortic pressure curve remains same, that is 80. Suddenly when ventricular systole starts, that is ventricular pressure inside the ventricle, the pressure is rising. Also blood is entering into the aorta from left ventricle, and thereby aortic pressure is also rising in the midpoint of the ventricular systole, and it reaches its peak at the initiating point of rapid ejection phase. And then as ventricle is going to be emptied, the aortic pressure curve and ventricular pressure curve both declines. But it is to be remembered that at the end of ventricular systole, when ventricle is not sufficiently pumping its blood, then also blood enters from ventricle to aorta, and this is mainly due to inertia, and it persists also in the first subphase of ventricular diastole. And interestingly, here is a fluctuation of pressure in the aorta, but there is no such fluctuation. It is simply declining in intraventricular pressure curve. This fluctuation is mainly due to when the ventricle is almost empty and aortic pressure is more than the ventricular pressure, this time blood tries to flow back from aorta to ventricle, because as a fluid, blood always tries to flow from higher pressure to lower pressure, and so blood tries to flow from aorta to ventricle. But as soon as it tries to cross the aortic valve or semilunar valve, the valve gets closed, and this causes a sudden rebound of blood from the surface of aortic cusp, and this causes a quick fall followed by a quick rise of pressure in the aortic pressure curve, and making it a notch, also called as dicrotic notch. So this is the reason behind the dicrotic notch: sudden backflow from aorta to ventricle, and then aortic valve closes, and this causes rebounding of blood from the aortic cusp surface. This causes the dicrotic notch, and then also blood starts entering from aorta to other capillaries, and thereby blood pressure gets fall down, and at a time it reaches its baseline, that is 80 mm of Hg. Now similarly, the heart sound S1 is the closure of mitral and tricuspid valve, so it is found at the initiation of ventricular systole. When systole starts, automatically the blood flow, to prevent the backflow of blood, the mitral and tricuspid valve gets closed, and S2 is found at the end of protodiastole, when ventricle is dilating or starts diastole. Then to prevent the backflow from aorta or pulmonary artery to the left or right ventricle, the semilunar valves get closed, making second heart sound. And sometimes third heart sounds are found, and this is mainly found and due to the first rapid filling. Due to the flow of blood, this sound is produced, and fourth heart sound is produced due to second rapid filling of the ventricle. So this is all about the heart sounds and different types of pressure curve. Now if we consider the ECG tracing, P wave is produced due to atrial depolarization. As always, electrical events in the heart precedes the mechanical events, so we will find the events that collaborate the mechanical event earlier than the actual happening of these mechanical events. So we will find this P wave just before the atrial systole, and we find the QRS, which actually denotes ventricular depolarization, just before ventricular systole appears, and we find the T wave to be appeared just before ventricular repolarization, because it depicts ventricular repolarization or ventricular diastole. and again the P wave is found at the end of ventricular diastole. So this is all about the ECG tracing, and this is a simple ventricular pressure curve. Ventricular pressure starts rising, and at the initiating point of ventricular systole it is almost constant or plateau. Then it gradually declines because blood enters from ventricle to aorta or ventricle to pulmonary artery, and then again it recedes down, and again it is filled due to ventricular diastole because now the mitral or tricuspid valves are opened. So this is a very simple graph showing various changes inside the heart or ventricles and atrium. Thank you guys for watching.